My name is Augustine Kehinde. I'm a DMP student from Brahman University. Today I'm going to be talking in Geodon, or another name for Geodon is called Zipraxidone. I'm going to be talking about Geodon today. Geodon is a psych medication used for schizophrenia and bipolar disorder. Classification for Geodon is a second generation atypical antipsychotic medication and is therapeutic for antipsychotics, mood stabilizers, and pharmacologic for Geodon is piperazine derivatives. Indications: Geodon is used for mainly schizophrenia or bipolar manic disorder. For schizophrenia, it is used in form of high intramuscular, and also you can use it as oral medication to control acute and agitated patients. For other medication, you use 20 milligram twice daily. For bipolar mania patients, and when you go into their manic episodes, you give them 40 milligram twice daily. Action: Geodon is effects probably mediated by antagonism of dopamine type 2 and serotonin type 2. Also antagonizes alpha-adrenergic receptors. Therapeutic effect for Geodon is it diminishes the schizophrenic and manic behavior in patients with schizophrenia and bipolar disorder. There are several adverse reactions or side effects to Geodon. The first one is it affects the central nervous system, which often causes neuroleptic malignant syndrome or seizure. It also causes dizziness, drowsiness, restlessness, extrapyramidal reactions, syncope, or tardive dyskinesia. In respiratory patients, sometimes it affects the respiratory system, causing cough or runny nose. Occasionally, it affects the central cardiovascular system, causing a prolonged QT interval or orthostatic hypotension. When it affects the GI, it can cause constipation, diarrhea, nausea, or dysphagia. Another adverse effect for Geodon is it also affects the skin, which causes rash or urticaria. The physical therapy implications, examination, and evaluation for Geodon. Patient or the caregiver needs to be alert for signs of neuropathic or malignant syndrome when patients on this medication. It could lead to hyperthermia or diaphoresis, generalized muscle rigidity, altered mental status, tachycardia, changes in blood pressure, and incontinence, limitation to therapy, but can only occur anytime during the drug use. Report these signs to the physician or nursing staff immediately. Also, patients need to assess the heart rate. They need to do an EKG and heart sounds, check the heart sounds, especially during exercise. Report any dysrhythmias or prolonged QT interval or any other cardiac problems or symptoms of rhythm disturbances, including palpitations, chest discomfort, shortness of breath, fainting, fatigue, or weakness to the physician immediately. The last thing, or the other thing that we need to be watchful for, patient or the caregiver needs to be alert of new seizures or increased seizure activities, especially at the onset of drug treatment. Document the number of or duration and severity of these seizures and report these findings immediately to the physician. Assess motor, physical, and alert extrapyramidal symptoms. Report these symptoms immediately, especially tardive dyskinesia because this problem may be irreversible if not quickly taken care of. Common extrapyramidal symptoms which includes tardive dyskinesia, which means uncontrolled rhythmic movement of the mouth, face and extremities, lip smacking or puckering, movement of cheeks, uncontrolled chewing, rapid or womb-like movement of tongue. Another symptoms of extrapyramidal symptoms is pseudo-Parkinsonism, which is shortening of gait, rigidity, tremors, pure rolling motion, loss of balance control, difficulty speaking or swallowing, mask-like face, akathisia, restlessness or desire to keep moving. Other dystonias and dyskinesias, dystonic muscle spasms, twitching motions, twitching, irritability to move eyes, weakness of arms and legs. Continuation of physical therapy implications of these medications are patient needs to be assessed for dizziness, drowsiness that might affect gait, balance and other functional activities. Patient needs to report this immediately to the providers. Any problems or functional limitations to the physician or to the nursing staff. And the patient needs to be cautioned and family caregivers to guard against falls and trauma. Patient blood pressure needs to be assessed immediately and report any fall in blood pressure when patient assumes a more upright position, lying or standing, sitting and standing, lying to sitting. Document all orthostatic hypotension and contact physicians when systolic blood pressure falls greater than 20 mm per mercury or diastolic blood pressure falls greater than 10 mm per mercury. Interventions. When patients on this medication, we need to guard against falls and trauma. If fractures, head injury and so forth, caused by drowsiness, dizziness, syncope, and extrapyramidal symptoms, implement 4 prevention strategies for this patient so that it doesn't lead to other problems. Because of the risk of dysrhythmias and abnormal blood pressure responses, used with caution. Dietary consideration or breastfeeding consideration when the patient is taking this medication. Capsule, when it's taking the capsule, they need to be taken with food. Breastfeeding is not recommended by the manufacturer. This medication is categorized as pregnancy risk category C, pregnancy risk factor, which is teratogenic to baby in the womb. And these are my references. Thank you for listening to my presentation on Geodon or Zipraxidone. Thank you.